What's so sick about this is everyone has been abused by the medical system. This is so totally standard. It's not illegal and it's not defensible, but it's standard.
Most, I would like to think, right? I would like to have this faith that most people that go into healthcare, whether they're on the business side, on the clinical side, they're doing it because they want to help people. They're not doing it because they're in it for the money. You know, every now and then you come across a surgeon who's like, look at my Ferraris. And you're like, yeah, cool, dude. But I think most people have a heart for helping others. And that's why they've put in the hard work to get to that point. And they want change. They hate how the system operates. They despise that the insurance companies have come in and done what they've done because they're the only ones winning is the higher ups that, you know, are the owners and shareholders and stakeholders of these companies. And when you look at that and you realize somebody just needs to have the gonads to step out and do it. You know what I mean?
Yeah.
And offer alternatives. And I think for a long time, people just thought, oh, well, we'll just move to a cash pay model. And it's, yeah, you can for certain things, but that doesn't cover everything, you know, and it's not sustainable long term. And then you miss a huge population of people from an access standpoint who can't afford to pay cash.
That's right.
And so I think, you know, these types of companies and businesses and what you're doing is what is needed. People who understand the relationships that you need to build in order to get that direct access to people without having the fluff of, you know, something costs $30, but on your bill it's $3,000. And you're like, wait a second, what?
Yeah.
Like, I'm pretty sure when I looked at my hospital bill, I'm like, did they just charge me for breathing the air in the room? Or
They did. Yeah.
2026, the talent market is still unfortunately candidate driven. And that creates issues of compression with your current team and what they're making. And then if you are hiring, what you're bringing in the new person at. Obviously, experience plays a huge role in this, but there's also kind of a general guideline that we can follow. And lucky for you, I've created a free copy of salary averages for PAs by state. So if you're listening and you're curious and want to have that copy, whether you're hiring or wanting to just compare and kind of see where you align, then feel free to reach out to me and I'll send you a free copy. Madison@advancedscopetalent.com.
Yeah, it's funny. You're right. Like the doctors that we work with, we completely make their day. You know, hey, I've got 2,000 new patients for you. And they're like, yay, my buddies are still in the system and I haven't been able to have the volume to hire my buddies. And so, and even when it's not a direct primary care situation like that, even the specialists are so happy. We have this one specialist in Kansas City who's a gastroenterologist, and he absolutely loves what we're doing. And he was like, I want to be the gastroenterologist for this employer. And we're like, great. And he gave us this great rate. And now he's out of the system, you know, and he does all the colonoscopies and he does all the office visits and the surgeries. And so people really can, I mean, depending on it, how many employers in the community are interested and how big they are, like you can really change these specialists' lives and get them free and remain independent of the big hospital boards that are eating everybody.
And I think a lot of people, because obviously on the hiring front, I see it where you'll ask somebody, okay, do you want the employed model or do you want the private practice model? And I think a lot of people used to just go the employed model because it was safe and it was stable.
It's easier.
It is. You know, I get it, especially if you're coming out of school, you've got all this debt and you're like, I just need to make some cash to get back on my feet. Like, I don't want to eat hot dogs for the next 10 years. And it is harder when you're in private practice because you are ramping and you're doing a lot of marketing and outreach and community-based stuff to get that client base in, that patient base in. But I also think there's a long-term benefit. And I think that's kind of where we need to be a little bit more careful. And we impact the healthcare system every day when we make that choice to play it safe rather than do what's right and what's best for the patient.
Well, and what's best for you. I mean, I think that people think I've just been through 8 years of hell. I just want to go to a job and not have pressure and just be a doctor people. And what they don't realize is all the crap they're going to deal with in there. And they're not really going to be able to doctor people. And all the incentives are misaligned against that. And if they would like take the risk and the stress of independence in the, 4 years from now or 2 years from now, they're going to be way happier.
Oh, yeah.
But, it's hard to, you also need to have the volume for them. And that's why working with employers is so critical, is like, we can deliver the volume and we can make this possible for you. And so everyone wins.
I think that's so key because you could go to these fellows coming out and say, hey, if you can set up something with us and we agree upon a rate, we'll send you people. You don't even have to do the marketing, which is the toughest part because they don't teach that in medical school. They don't teach you how to,
Business.
business, anything. And they do that, I feel, on purpose because they know, oh, we can create another number that we can control, that we can make sure that they're, working these hours and burnt out. And they'll never have that autonomy or that independence, and they'll be kept from their family, and they'll have to work weekends and holidays and blah, blah, blah. And it becomes just a rat race. And then you see burnout and people wonder, why do we have a disparity? Why is there a lack of, not only people not going into the industry, but people going, I'm not doing this anymore. Bye, And so I think it's a real issue. And I think that what you're doing is a great solution to it because it bridges the things that people hate and it creates a solution to say, you don't have to work harder to still do what you want to do. And you can do it without having that pressure of you've got to see X amount of patients to meet this billing, to be able to even profit any to make your time worth it.
Yeah. I mean, we have to work harder than anyone else, but they don't have to. It is hard to do. It doesn't always work smoothly and easily. And there are lots of gaps we have to address. And so it's still a work in progress, and the big industries or the big players it's like whack-a-mole. They're coming up with techniques to evade our tactics. And then so it's sort of this game of whack-a-mole that we're kind of chasing each other. The big industries, whether it's the PBMs or the pharma companies or the hospital systems or the carriers who are always trying to make a buck, and we're trying to pay fewer bucks and get higher quality care. And we're just chasing each other around the business, but it's worth it. I can sleep at night. And so that's
exactly
when I got out of the White House, most people with my resume, they just go and they shill for industry. And, there's nothing wrong with that. I guess I couldn't do it. And I just was too disgusted by the corruption I'd seen in these industries. And when I look at the healthcare landscape, everything in healthcare was apocalyptic. There was no bright light anywhere except this one little community of kind of innovative guerrilla style benefits advisors who were doing this thing. And I'm like, okay, I'm going to go do that thing. And I just glommed onto them and made them teach me. So I'm glad I did it. But it's hard. It's hard. It's war every day, but it's worth it.